Yes. Yeah. Mm.
Swami, you.
Doctor, if you want to see a gallery view, there's also a gallery view. You press the three dots. There's something.
Okay.
So you can
Ah.
see them, all the people at the bottom. If they turn on their videos, you can see the video.
When the three dots, then it says what should I gallery. Okay. If I just like do gallery video and then if I do the
For
share
example, I turn on
condense.
my video, you can see me also in the gallery.
Okay. So then if I look at the PPT, which is missing now, where is the presentation now?
It has gone 2 months, you have to just go back and
Okay, now I don't know why so many other PPTs are coming up, but I can't see the other one. Okay, let me see. Okay, let me then try the.
So what I'll do is once you're ready, and we have a fair number of people joining, as I already see, I'll introduce you, doctor. And once that is done, you could start the presentation. We could also have, if you like, an interactive session too. So usually the Mandhaara goes on for about 30 minutes with some question and answers.
Okay.
And our fellow Sasians sometimes warm up. One person will always ask a question and then there will be more that follow. We'll moderate that question and answers by getting it into the chat window.
Okay. Okay.
So I'll be the one introducing you. Now that we have another friend of yours, Amita Pandey, maybe she can do the vote of thanks.
Okay.
Constantly talk.
Just a thanks, sister. There's nothing. It's enough. Don't need
it will be a pleasure. It will be a pleasure.
Thank you, Amita.
Thank you, Amita. Thank you.
Thank you. Thank you. Yeah.
So we'll just wait. It's just 4 o'clock. Deepa will tell us when we start.
So if she is ready, you can start. Can you see the presentation now?
Yes, I can. Thankfully.
All right. So you can start now.
Yeah. Good evening. It's a real pleasure to welcome Dr. Carolin to be our distinguished guest at Mandhaara. A tradition that's been going on in Saskin to get people from communities outside of IT and the IT technology industries to talk to us and share their journey and their passion and their interests. One of the things that I was cautioned by Dr. In terms of providing the introduction is she said, don't go overboard. I am very uncomfortable if I'm praised. And maybe that's because she was, in some sense quoting Luke, which basically says in the Bible, we have only done our duty. So maybe that's what has been guiding her when she says, don't praise me. But Luke also provides a certain provision to praise people who are dedicated, who are outstanding, who are caring. So somebody who's dedicated, somebody who's outstanding, and somebody who's caring, you can always say good words about them because we benefit from these acts. So it's with great pleasure that we welcome Dr. Carolin, a public health specialist, who is heading the Community Health and Palliative Care Department and is the chair of research at the Bangalore Baptist Hospital. It was, I think, in Jan of last year that when Neerav, a former Sasian, Deepa and myself went and met Dr. Carolin and several of our other colleagues, Dr. Norman Gift and Dr. Naveen Thomas, we were actually exposed to the brilliant work that the medical fraternity at the Bangalore Baptist Hospital has been doing for a number of years. Of course, some of these things you don't know unless you meet the people. And we were really, really captivated when we saw at the outskirts of Bangalore the marvelous work they do. Of course, we got only a glimpse of what they do because in the short time that we spent with them, we couldn't have seen everything. But at the Mother Teresa Hospital there, we could witness firsthand ourselves, barely 35 kilometers from where I'm sitting right now, which is in the northern part of Bangalore, where patients were being cared for and loved for in a very tender and nice manner, irrespective of what their ailment was. So to caregivers, she's a representative of someone who's dedicated a lot of her bandwidth, attention, and a career to providing service to the community. So it's something that struck me as absolutely profound. And from then on, I've been wanting her to come and speak to all of us about this. Over to you, Doctor.
Thank you, Swami sir. It was really kind of you to introduce me. Um, I just wanted to thank for this opportunity. First, when you said, I didn't know that it was such a, so many people will be listening. So anyway, so thank you for the opportunity. I'm just going to share. I can't.
You can go to the presentation mode, Doctor.
Yeah, I'm just looking at the thing again. It's from the window. It's not seen. Let me see once more. I'm unable to see the presentation here from the window. It was there once. Just kindly bear with me.
Sure.
If you want, you can share it with Ameya and she can present it.
That's
and
also.
She can talk home. Yeah.
Oh, this is something else. This is something else. How do I stop it? Now it came. Okay. Is it seen now? In the.
Yeah, Doctor, just
put it in
yes. Yeah, perfect.
Yes. Okay. Thank you. So what I'm going to share is the last 10 months, basically seeing what happened to when the COVID came and how as a team and as a hospital, how do we respond to it? And just wanted to share things that we have gone through real time and how we went through it. So that's just wanted to share those things. So to introduce ourselves, I wanted to talk more of in terms of our ethos and the institution which I belong and which I represent. So who are we? Or as you said, I am from the Bangalore Baptist Hospital. And then when you say Bangalore Baptist Hospital, many people said, who are we? So and we say it's a Christian Mission Hospital. When you say Christian Mission Hospital, the values which we stand for, we would say, as Swami sir was saying also, some of those things. But the most important thing that we would say is a team who believes their ultimate purpose is to glorify God by doing the right thing and by holding on to our values. That is to love God with all our strength and to love others selflessly, to place other people over us. And all praises to God. So that's what we believe, and that's what, as a Christian, we do. And we are coming together in healthcare. And a brief history: we are a tertiary care hospital, 340 beds. We have 75 ICUs, and our board is the Christian Medical College, Bangalore. We are the first mission hospital in the country to be NABH and NABL accredited. We are a 200 crore over turnover, but our care is designed for all. We say that no discrimination between religion, caste, or creed, or social status. And we have a designated department, the community health department, to reach out to the poor. So what we say that there are people who actually may not have access to the hospital. In the hospital, we treat people who are coming, but at the same time, we also want to reach out to the people who do not have the privilege to come. Maybe they don't have the finances, maybe they do not have the knowledge, whatever it is. So we feel that we should go and serve them. And we cater to 1 million people in slums and almost a million in the rural areas. And we are a health team of 102 people. We have doctors, nurses, social workers, we have psychologists, we have drivers. So it's a diverse team. Now, we were doing all these initiatives and, with Saskin also, we were doing things. And at that time, the pandemic hit. And we were watching the other countries and the news coming that, people are dying and it is reaching multiple countries. And at that time, we also thought, what if it hits India? We have a lot of other problems, health inequities, and we are working with the poor. What will happen? All these uncertainties. And finally, we also, first it was in Kerala and 3 cases, and then it stopped. And after that, the next set of cases, and India was also hit. And the world came to a standstill. And for us also, it posed a lot of questions. And we should say it's like March 23rd when the country went to a lockdown, and we know suddenly everything changed, standstill, froze. And the cases also enormous scale and with overwhelming speed, and it hit all of us. At that time, we had a lot of questions, the vulnerability of our situation. If I talk about health care per se, we know that, it's a pandemic which is affecting. And at that time, when it was in the European countries, it's almost 30% mortality. And then now we are talking, it's come to India and it's hit Bangalore. And we know we are working in the slums, we are working where, it's really tough because all that we talk about, social distancing, mask, hand hygiene, nothing works there. It's like close proximity. This raised a lot of questions among us. We asked, should we continue going to slums and villages? Should we pause for some time and see what's happening? Will we die? What will happen to our families? Will I carry infection? Will I give this infection to my loved ones? These were real questions. We also, as a group, as a team, we sat together, all of us, and we acknowledged the situation and its seriousness. For us, it was not like, okay, is it true? Yes, it is true. Is it in front of us? It is in front of us. And we realized that our values were at test. Because our values, we earlier said, to do right in front of God, and second thing, to put others. It was never self-preservation. But the first time when this hit, we had asked ourselves the questions. And in humility, we said, is it safe? Should we go? And it was a very, very tough situation. And it's like a moment of high tension among ourselves, a lot of questions, we don't have answers. So what did we do? We sat together, we were transparent, we exposed our vulnerability, and in humility, we understood that we don't have answers. We have only uncertainties. We don't have answers. Things and facts are changing day by day. And we didn't have any answers. But we collectively reflected. We sat together and exposed ourselves, and we spoke truth, and we did it in a collective way. The question was, is it dangerous? We said, yes, it is. Will we die? We talked about, safety measurements. And at that time, we should think of, there was everything locked down. We are not getting PPEs. We don't have the finances to have multiple PPEs, and we don't have the supply chain is broken. So in that time, we said, we can do whatever we can, the safety precautions, we'll try. But the truth is, there is a possibility of death? Yes, there is. Can we take infections home? The fact is, and the truth is, yes, there are chances. When will it end? And we said, we do not know how it's going to unfold. Then looked at our values. What are we here for? We said, yes, to reach out to the poor. Do they need us now? Yes, because at that time, everything in slums, everything in villages, literally everything closed. Small institutions, small medical institutions, they closed. The government were gearing up for COVID, and literally people didn't have any place to go. So they needed us. We also, since there was lockdown, there was problem in getting all these N95 and personal protective measures. There was lack of suddenly the OPDs, our revenue all got cut because lockdown, we got affected. Uncertainty of even if, even the salaries, we do not know whether the salary will be able to pay our salaries, whether we have to take cuts. whether they have to, in terms of defer the salary, there may be, it all depends upon it. At that moment, we do not know anything, but we know that there are chances of all those things. But in terms of, with knowing all these things, what is the right thing to do? And then we said, we are here to do the right thing, not what is safe, not what is convenient, because that does not match with our values. Then there were these questions. If we carry infection home, if something to happen to our family, to our close or loved ones, somebody dies, what happens to us? And then again we talked about, do we have to feel guilty? And then we clarified ourselves. Guilt is when we do things wrong and things happen. Here we did the right thing. Definitely losing a loved one is a painful experience. We will always feel loss of love and we grieve, but do we have to carry guilt? We said, no, the right thing is always right. And it is independent of outcome, what happens. So again, these were reflections, and we made our things, more and more clear by talking about among ourselves. How did we communicate this value? We also were very clear when we were talking to each other that it was not to be dictatorial. It was not that somebody, some inner circle sitting together and thinking about this thing and others were told to do this. No. It was also not to tell people to trick, incentives, risk allowance, this, that. It is not for any of those things. We never gave any risk allowance for anybody. Not because we could give or not, we could not. We felt that is not the thing. We do it because it's right. We are not doing it because you get money or you're given anything, nothing. So that's that we were trying to appeal to the conscience of people and say, understand what is right. And nobody had a clear answer. We were actually talking to each other and getting it more and more clear for ourselves and for each other. And in this, we found a lot of psychological safety and trust. We understood that some people among us are courageous who wants to take the first step. And there are some who wanted to take more time. There was no moral judgment on anybody. We just kept on encouraging to do the right thing and reflected on what the right thing is. And we were God dependent. We said we do the right thing, and we believe that God and faith is with us and it will help us to sail through this. So there is this balance between the realism and optimism where we acknowledged humility, exposed our vulnerability, and we also promised each other a togetherness to look after each other, to look after the people whom we care for in the community. We also prepared for the worst in mind, but hope for the best and put all our trust in God. That was the first where we made everything clear. So then how did we approach the pandemic? The first one, our purpose and our values, shared frame of reference and collective decision, the thought that we have to be relevant to the communities we serve, and we have to be relevant to the needs of each other. Also, when there is pandemic, things are changing, it is called for rapid action. So we kept ourselves saying that whatever we know, but we may have to change. We may have to think differently and we have to act fast. All our energy and focus at the same time, but at the same time looking for wider perspective. If we are investing or doing things, will it be useful later? Is it good for it to the community in a long time? So we looked for both these things. Then comes the action. So we have to say again, in action, everybody pitched in and came up with new ideas. Our roles changed. The drivers, they learned how to put the PPE, don and off, how to transfer patients, if they have to take a COVID patient to some other place, how they have to do, how to sanitize before, after, the nurses, everybody triaging, keeping things, new things, hypochlorite. There are so many things which were coming. The science were changing rapidly, and we actually looked into things and made changes. So rapidity, agile, we were very agile, changing things very fast, and also very in our minds taking new roles up. Inclusive, that was also another thing. From the driver to the top, everybody was in it. All there. We also are the one of the organizations which has given universal PPE. Everybody outsourced. If you're a cook, you will get a PPE. If you're working in mortuary, you will get. If you're a driver, you will get. Everybody was taken care of. Empowered. You were able to take decisions, come back, because many times at that time there is a lot of times that you have to take, there is nobody to ask for. So later we would look at it, but they were empowered to take decisions. And above all, we said all our decisions should be selfless and collaborative. The first important thing that we looked for was safety of us and each other, looking after each other. So we looked into the science, what are the new things, at the same time ethics. It was at that time a lot of, I would say, the lockdown posters, there was not even a piece of cloth available in Bangalore. Then we had to call many of our friends, bring the whatever cloth which is available, getting local tailors. Then the police will come and shut them down. Then we have to write letters to them to open it. And then so many things at that time. But within March was the lockdown. By April 22nd, we gave the first PP. There was one vendor we came across through some of the friends, and then he supplied us with reusable PPs, because at that time we were looking of also important for us was the cost saving things. So things which can be washed in hypochlorite and can be reused. And I should say he came with all the materials. We were designing it, and at the end he's no more. He died of COVID, but he supplied us so much things. Anyway, so yeah, so that's the safety. So the first thing that we looked is the safety, the personal protective measures. We looked into our clinics, what is safe, what is unsafe, segregated the patient flow, fever clinic separately. Then we looked into, in slums and many places, it was not possible to have exhaust, but we moved into open air, then whatever we could do, but in the best way possible. But we know that we could never reach the ideal, but try to reduce the infection so that we are safe, our patients who are coming are safe, and the transmission level is very less. We also reached out for collaborations. I wrote a letter to Sasians also, and helped me with money. The money was resources. We also helped we talked to our board, CMC, about their infection control practices and how we can contextualize here. Spoke to people, colleagues whom we know in US and different places who had more experience, because it had happened there before us. So we talked with whatever resources we could possibly, and everywhere nobody knew the answers. It was like more of trying to see what works for us. With all this, what did we do? What did we achieve? Our clinical services, we continued. Not even a single day we closed the last 10 months. All PP, we fixed all the exhaust, suction instruments, most, so that the infection is less, and we could do all the procedures. You can see the doctors and the crew, everybody wearing PPEs, and the suction, taking the exhaust thing out. And also you can see reusable ones, so that we are very conscious about our cost, but at the same time safe. Last 10 months, we saw 13,517 patients, and we referred 637 people for other care in terms of tertiary care. They required oxygen, or they required COVID admission, all those things. Also, we when the government said you have to start a new COVID, and we didn't have enough beds. So within a week's time, we converted the classrooms into COVID care centers. We set up all the things which is required, and people were started, and we managed. We had total of 352 patients. The hospital, the entire hospital catered around more than 2,000 patients, but the COVID care center 352 patients. Concession again, a total of 17 lakhs in rural areas, in an urban area, because we understood that many people didn't have money. They lost their jobs in slums and even in villages. So we gave more concessions, and that's one need. Also, another thing, other things took a back seat. For example, if you have cancer at that time, people do not want to come because they didn't have transport, they don't know where to go, they're scared of COVID. At the same time, money is a big issue. So we facilitated different other treatments which cannot wait because of COVID. And the example is Sushilama. She had her cancer surgery, radiotherapy, chemotherapy, all during COVID-19, and we concession amounting to 24,74,740 rupees given only for that. Bringing from community and doing giving. The other thing, what we realized that in rural areas, a health team coming from here to the villages. In the clinic, it's okay. Mother Teresa Hospital people with with symptoms can come, but when we go to their villages, it's a problem, because we may be carriers of infection, because we are taking seeing patients. Also, we are going and doing repeated duties in COVID centers. So we know that when we go to a village where naturally their infection chance is less, but we may be carrying. So how can we give care to them by less contact with them? So that's what we were thinking, and then we came up with a telemedicine solution. Initially, it was a tough thing because we had to go for our own solution, because the bandwidth of many of the existing thing was high, so that it did not work in these villages because of the range issues or something like that. So we developed something, and then you can see that our field assistants were selected from these communities and trained over a decade now. So they are quite tuned to them, and they to the medical procedures and medical things. So they were able to go to their place, the people's homes, and they were able to do a BP checkup, a blood sugar checkup, and then they can do the doctor consult over them. So that, and then they used to come and give based on the prescription, give medications to them. So you can see we used in homes consult, then there were consults in Milk Federation, and people getting this. And people, we were first apprehensive, whether people accept it, but they were very happy, and seeing the same doctors used to come there as mobile clinic, they are seeing over the phone, and the same field assistants are checking them. So they were quite happy. And it was low cost. At the same time, most places, wherever we could not reach out, we found the people's sugar and other things were so there are people who went into renal failure or a kidney failure or got a stroke or heart attacks because the care was neglected. Same time, we were happy that we could use different ways to reach out to them, and their health could be optimized because of all these things. There were other people whom we had to reach out. One of them was terminally ill people. If during COVID time, people didn't have access. If you don't have a vehicle, then transporting them to a hospital was very difficult. Second thing is, if you have a cancer or something, access to morphine, because without that it will be a lot of pain, and and the government hospitals were repurposed for COVID, so they could not go to any of those places. So our palliative care team reached out to them and then tried to help them. Like this lady, her name is Gangama. She had a cancer, and towards the end she had a lot of pain, and she required morphine, and somebody had to dress her wounds so that it's not foul smelling, no secondary infection and things like that. And we could, their family members called, and we had to take police permission. Somehow we reached them, we provided care, and you can see you know, the first, you know, they cleaned the wounds, they prayed for her, and, you know, with morphine, she could the next day sit out and then start doing her work. And she eventually she passed away, but with a lot of, you know, a pain-free death, and I would say a good death. And we have done like that 7,211 house visits in the last 10 months. Another group was people with disabilities, again with normal transportation and everything is out and running, then itself people with disabilities very difficult to access care because, you know, the transportation and things like that. And with COVID, it was impossible. Again, we were happy this man got his crutches. There are like we given aids and appliances to 181 people. Had a lot of children got special education, speech therapy, physiotherapy. We also we identified very vulnerable, give rations. We constructed disability-friendly toilets for people. So whatever we could do with whatever limitations we did. You can see all the children with standing frames, and, you know, this lady who got a crutches so that she could move in the house. Another neglected area or mental wellness. There are people who, one is people with psychiatric disorders who used to take clinics or go to the clinics in Nimhans or you know, other hospitals which got closed or repurposed for COVID. And at the same time, the transportation was totally impossible. So we ran community clinics for psychiatric disorders, consultations and home counseling, home psychotherapy. We also identified new people with suicide risk and tried to give counseling and psychotherapy to this vulnerable people. Another one was rural home health monitoring. You can see the people from the field assistants who were trained from these villages. So they used to do frequent visits to the villages, taught what is, you know, how to prevent themselves from getting COVID. And if somebody gets COVID, what to do. Taught them how to do the hand washing, gave them medications if required. If there are people who are having problems with accessing health care, we tried all possible ways where we could actually bridge this gap. So these are our numbers in terms of, you can see the home visits, around 7,000 home visits, 6,000 odd counseling, medicine 1,000 odd medicine distribution, breast cancer follow-up, mental wellness follow-up, home BP monitoring, blood sugar monitoring, community meetings, awareness programs, multiple things we could do at the community level because there were people or resources we built at the community level. Okay. So these are certain others. So these were all the care, direct medical related things that we did. And apart from that, we also started certain initiatives which are not directly giving medicines or medical treatments, but mostly promoting good health. So one is starting with this home visits and COVID conversations. Some places it was very difficult. You know, the people were scared when you talk about COVID. You know, they scared. You know, they take them to places like you know, government shelters and things like that. So we had to slowly talk about it, but you know, we had the trust of the community, so it made it easy for us to do the home visits and teach them, even in the most constrained setting, what they can do, also other routine things. So basically engaging in health conversations. Another area we got attention was the migrant workers. Wherever in the Mother Teresa Hospital near also, we found that migrant workers coming for shelter and looking for transport. So we helped them with rations, transportation, and also health checkups. We also partnered with other organizations who were helping these migrant workers to go to their respective places, but they required medical help. So we partnered with them in providing whatever help from our side. Another area was giving food supplements. We, especially the areas where we work in the slums and the villages, we found that suddenly there's loss of colossal loss of livelihoods. People lost their jobs and no food on the table. So since we could we know them personally and we had access to people to give it to them, so we did distribute around 1,500 kits, ration kits, in slums, in the house of people with disabilities, in terminal cancer patients, and wherever we found, or the village, we had formed health committees in villages. So sometimes people used to call us and tell there are people who are in need, and we used to reach out to them. Another thing is, especially places where there is a lot of immunity problem, we try to give them, and also food is in shortage. We supply children with protein bars, immune supplements like vitamin C and things like that, so that their immunity can be built up. And also people with leprosy and all vulnerable. Another one I could think of was the livelihood initiatives. There were people who are like, especially people whom we have de-addicted from alcohol earlier, and they had jobs in airport or flower gardens and things like that, and suddenly they lost their job. So we wanted to engage them in some productive activity where they can earn and so distract themselves from going back to alcohol and things like that. So we've given livestock, and also in slums and villages we have engaged people from the community to make masks, and they could earn this. Each person was able to earn around 4,000 rupees in 2 months time. And also loans for starting vegetable gardens or livestock, and around 32 people were helped by these initiatives. Another program is called the Health Entrepreneurship. This was started around 6 months back. This whole pandemic started. The whole purpose was to identify people from these communities, vulnerable communities, and train them in some health skills, so that they can also be part of the supply side. That is not only receiving care from us, but also able to give care. So we identify certain skills like blood pressure, blood sugar. These are things which can be taught and can be monitored from us remotely. So we had made kind of with the University of Sheffield, we had made certain kind of applications so that which helps them to do it, and we can remotely coach them and also give health advice if something is deranged. And during this time, what we understood that when PHCs closed for COVID or were repurposed for COVID, all these routine health measurements became a problem. And these people whom we have built in the community were considered as quite skillful people, and community started taking their services. So we understood that this has a lot of potential, and we started training them again, and more number of people for these kind of initiatives. When the lockdown eased out and people start all the economic activities, like Milk Federation started, milk things, factories restarted. So at that time they required help in terms of planning, how can we reduce the transmission in their settings, and what should they do when these things happen. So we also helped in risk assessment, risk mitigation, and linking up with us in terms of if you have anything, you can call us and we can help us to real time guiding them. So this was another thing that we have done. Another thing was knowledge partnership. We did not interrupt any of our services. So when others stopped and then they reopened, they wanted help. How did we do it? So since we did it, we were able to help them contextually, especially if it's we run the disability program here. So the Gulbarga and Belgavi, when they restarted, we could help them in reducing transmission risk. Also, we helped other hospitals who, for example, the hospital in Madnapalli, they started COVID care centers, and we helped from here how to plan the PPEs, flow planning, where should be the cameras, logistics, the infection control protocol, the treatment, the oxygen protocol, everything we could do it remotely from here. Also, we understood that there are so many other NGOs who did not have any health background but came to do humanitarian reliefs or COVID response during this time. So they required health skilling in these and also COVID training. So we did certification courses and also other trainings during this time. Another initiative was COVID-19 response team. This is a concept in which the village members are the most important people who would be the custodian of health COVID response in a village, especially the village milk federation, Anganwadis, and people who are PDOs. They formed a group and we trained them on how to take care of the COVID-19 patients. If somebody becomes positive, what should they do in terms of giving food to them, and also checking them, lending them the SpO2 machines, and also ambulance alert if they require, facilitating e-consult with us, and also listening with us if there is any requirement. So when there are no other things, they used to do the prevention, mask, hand wash, social distancing, and bring sensitization and awareness in their community. And they used to do regular screening in wherever there was economic activity and congregation of people, like in terms of milk federation, people used to come and give the milk, so there's a big crowd, so they used to do checking for SpO2 and also fever and things like that, and also facilitated treatment, facilitated investigations if somebody was sick, and also helped with provision of secondary care and ICU care transport, licensing with us. So this was a very innovative thing, and people felt very happy that they could do this during the pandemic. They could be useful, in their villages, and they felt a lot of ownership. So this is a training where people have come for training. These are village leaders, and this is a gentleman giving a COVID positive patient ration so that he and his family can be isolated and do not have to go out to buy rations and stuff like that. At this time also there was a lot of news coming about misinformation, myths, and everything. So we also felt that's a duty to bring science in a palatable form and up-to-date information, also dispel myths, and also opportunity for community to ask questions. So we made videos, we had informal chats, formal sessions with the leaders. We collaborated with the journalism schools to have responsible journalism. We also had used clinic as special counseling to dispel myths. And we reached out to many people by the awareness programs and through our videos. And you can see multiple arenas by which we try to build awareness and sensitization and right information. And last 10 months, 10 of our staff became COVID-19 positive. Some people were very sick, but with God's grace, all became well and they're back to work. So if I look back, I would have to say my team, their courage and conviction. So, in terms of having values is one thing, but to come and take that decision saying that, yes, we should do this and this is the right thing to do, that was something. And the roles they played faithfully, multiple roles, and cheerfully. It's nobody said, somebody's pushing me, I'm doing because somebody's looking, nothing. They said it's a historical moment of crisis and we could do whatever we can. They were very happy. You can see it's the drivers, the nurses, and doctors, everybody. Should also look back and thank our families. This is my son Aaron. It's taken on 7th July, 10:33 p.m. Within few days, we were planning to start this COVID care center. And I had this plan, and he's telling me, Mama, so, oh, you are going to bring oxygen here, and he's putting his own thing. So how do you take care of this thing for them? How do you do this? How do you do that? And he was giving his idea. And I said, I had this conversation, I said, he had asked me, Mama, is there a chance for you to die? And I looked at him and I said, yeah, mostly I won't, but there is a chance. And I could see him tearing up. But then he said, Mama, I'll manage. So, I mean, these were all real conversations, and yeah, it was tough. So this is like many times in the initial time, I used to be in one room, and then reduced contact with others. So me and my son used to write letters to each other, saying that I'm going and this is what I saw, you should be doing this and things like that. And sometimes I used to sleep and he will write, your phone is charging, good night and love you, Mama. He'll tuck in a note on my under my pillow. So it was all these things. That's my mother-in-law. I stay with my in-laws, so she will come, and this one picture she used to give me pluck the jasmine flowers and give it to me as I leave to the hospital, and I used to smell and I say, oh, I can feel the smell, that means I do not have COVID. But yeah, so it says that it's not my story alone, and I know everybody had these stories of their families. Sometimes it was tension, sometimes it was like, but supported at the end of it. And so it was a tough journey for all of us. And then it's a heartful gratitude. It's God's grace that we are all alive. And also, we were not alone in this. So many came forward, to support us with during this journey in terms of prayers, words of encouragement, money, whatever, food, PPs, many things. So we did not do it alone. It was so many people whom I cannot name, so many people who were in it with us. So some of our patients whom we cared so dearly could not make it. That's our sadness. Some of us lost our loved ones in COVID. Some of us struggled in ICU with COVID but came back. Some of our colleagues are no more, and some left the fight. But when we look at with all these things, it was a testing time to be true to our calling. When we look back, we say our interpersonal relationship became more deeper and more meaningful. And it was testing, or it was also a reflection of who we are. And we should say that when we look back, we came out stronger. So trusting in God, holding on to our values with prayers and support of each other and of many, our journey continues. That's it. Thank you.
You can stop sharing.
Okay, how do I? Did I?
Yes. No.
No? Did I? Did I stop sharing?
No. You just need to go to the same rectangle.
Yes, it says share. Now it says share content.
Okay.
Is it? Is it now sharing? Because
Yes.
now
Okay.
also it's.
Yeah.
Okay, is it because of?
Yeah, it stopped.
It stopped? Did
Yeah.
it? Okay. Thank you.
So, Dr. Carol, thank you. That was really inspiring and touching.
Thank you.
What we will do is just a simple thought I have in mind, and I'll just share that and then open the floor up for some questions. Sasians, thank you for listening. Please post your questions to Doctor in the chat window. Then it will be brought to the attention of Deepa or Amaya, and we will read out that question. So we can probably take about 3 questions. One thing that I note here is your team of 102 people, even if I take 2 away from there, and you cater to 2 million people.
Yeah.
It essentially means one of you supported 20,000 people on an average. So that's a stupendous amount of effort. These 10 months, I think, has really, really inspired us. But you went through it, you and your team. So I request everyone in this conversation to please once more raise your hands, put your hands together, and extend.
Thank you. Thank you. Thank you.
I see Krishna Kishore, I see Anuradha, I see Naresh Neelakantan, I see several others. Amita, of course, you're very familiar with doctor's work. I see Sindhu. Any one of you can please ask questions.
There are some questions already, if you can read it.
Yeah. So let me go to the chat window now, and there's a question from, or there's a comment and a question perhaps. Thank you, Doctor. This is from Naresh Neelakantan. Thank you, Doctor. Really insightful and inspiring in these terrible times. I don't know if it's the right question, Doctor. It was indeed a chaos, as you rightly said. I was in a dilemma whether we could justify ourselves morally, as I lost more than a handful of relatives and friends in COVID or non-availability of healthcare. I would be more happy if you could provide any news on how do we register for vaccines, COVID app, as I do not have more family members including. Yeah. That's
Yeah. So that's I'm sorry to hear you had losses. I think it was I can't say it's a lot of things. Difficult thing even for us. We have not processed that thing. The deaths that we saw and things like that, and but vaccine really is a blessing. But currently what is happening is government, it is under the government control, and what they have done is the first priority list, they have fixed it as the healthcare workers, army personnels, and the people who are working in the frontliners, which they classified them. It is not open to general public now. So what they have done is they have taken a census, and they have asked earlier, I think around a month back, they have asked names from all the institutions, names, their ID proof and things like that. So probably that would be the first list, and then they would open very soon a registration process. Till now, to the general public, it's not or any other, like in terms of vulnerable, like elderly and things like that, or doctors' recommendations, they have not opened up anything. So we have to wait for what government in UK and this thing, there was actually a parallel mechanism. They also opened it and asked people to register. So suppose if there is like 5 people from healthcare is supposed to vaccinate today, and only 2 turned up, because not everybody will want to, so then they would take from the other list and give that 2, because you can't waste vaccines once you open and the cold chain is gone, then they have to use it immediately, otherwise it's a waste of resources. So that's how other countries have done. So our thing is it's still unfolding. I'm sure government will come up with a more detailed plan soon, but now it's not, we do not know about it.
Thank you, Doctor. There's another comment, actually, I'm sure this is from Anuradha, who in our team also works in a lot of the rural initiatives, but for financial inclusion. She's put something that I'm sure everybody in this call would echo. Dear Doctor, nothing we have done so far can ever come close to what you and your team have accomplished. Truly brave and extremely caring. Great work. No words. Thank you so much for sharing your experience. So Anu, thank you so much for expressing this.
Thank you so much. Thank you. I mean, I honestly, I feel I've not done anything great in terms of this. As you really said, is this what's supposed to do? We are supposed to do that. That's the right thing to do. Yeah, it was tough. It was tough. That's it. And yeah.
So I once again open the floor for a couple more questions. A lot of thank you messages coming in. Again, thank you, Doctor. You're more than God, which is in front of us in daily life.
Oh, no.
I understand. It's just an emotional reaction. I'm sure they mean it well. So yes. That's what it is.
I know.
If there are any further, there's again, thanks, Doctor. So we do realize that we've been at the receiving end of medical care. You've been at the providing end of medical care. So it's so wonderful to listen to your journey. If there are any other questions, I will take a couple more. Otherwise, I will turn it over to my colleague Amita, who will sort of formally thank you for this wonderful session this month. I think I don't see any questions coming in the chat window. People are still soaking it in. There's Purushottam who says, selfless work is the greatest service. Thanks, doctor. Over to you, Amita, for a word of thanks.
Thank you, Dr. Carol. And right through the pandemic, we've been talking. Yes. And one thing that always stood out is when I asked you, doctor, what's going on? And you would say, you know what, whatever numbers you're seeing, just multiply it by 10. So whatever you have shared with us today, the magnitude of what you've done is also into 10. That's the way. It's just your humility which is not bringing that out. The other thing that I have seen is that you've had only one thing in your mind. It's just been a single-minded effort that how is it that I can serve? How is it that I can do more? And I'm sure these sentiments are of your entire team and across all the doctors throughout the world, that they only had one intention, that, you know, what is it that I can do in these turbulent times? Again, which stood out, which echoed every time I spoke to you, was your positivity. And I think these are the lessons that we, apart from the wonderful experience and the turbulent times that you've shared, what we need to learn from you today is that so very proud to be associated with Baptist Hospital, with you. And we want to keep with us the strength, the positivity, and the gratitude. So thank you so much for coming on this platform and talking to us this evening. Really wonderful. God bless you, and God bless everybody in the team. Thank you.
Thank you so much. Means a lot. Means a lot to us.
Thank you, doctor. Thank you very much.
Thank you. Thank you. Thank you.